presenter is Dr. Julien Haroche, and he's from, I don't know how to pronounce this, Hospital Petit Salpêtrière, Paris, France. His abstract title is Longitudinal Assessment of Cardiac Involvement in Erdheim-Chester Disease using Cardiac Magnetic Resonance Imaging.
Thank you very much for the organizer to having selected this abstract. It's actually the work of Levi, who's a resident who's been resident for a couple of years toward the ends of his residency, and who was very proactive in all these studies. So actually, I have a personal history with ECD, as you know, and the heart. Actually, I fell into this disease with describing cardiovascular manifestations about 20 years ago. And then I became friend, and I discovered Augusto Vaglio after his first study or case report in Circulation, I think maybe 15 years ago, describing pericardial involvement. And so I think it's been clear in the past 3-4 years now, even more, 10 years, that atrial infiltration and pericardial effusion are hallmarks of cardiac involvement and of the disease, even if it's less frequent than hairy kidney or long bone involvement. It is well-known cardiac manifestations. And so it can lead to clinical complications. And I already presented a previous study back in 2018. I think it was in Orlando on cardiac imaging of ECD. And there was a very long gestation to publish this result late 2022 under the again, it was Levi who made this possible and reported more than 200 patients. And clearly, I think MRI of the heart is now one of the gold standard to analyze the infiltration of the various layers of the heart. And so in this study, we had 200 MRIs of the heart. And so you can see half of the patient had either atrial infiltration or pericardial involvement. And on multivariate analysis, there was no worsening and no higher risk of death, but there was a higher risk of clinical event. And in this same study, you can see that there is almost like a causative link between BRAF and certain location of infiltration, in particular the right atrial infiltration of the heart, with an odds ratio of above 7. And you can see here the outcomes with death, conduction disorder, cardiac tamponade, which is a rare but well-known mode of entry of the disease, and coronary heart disease, which are now well known. So the evolution under treatment was poorly studied, and we took advantage of this population of patients using the cardiac magnetic resonance imaging to see what we could analyze in terms of evolution and treatment. So every patient who had an CMR was included with of course, with a cardiac abnormality, so cardiac involvement, and they underwent at least one follow-up imaging between 2005 and 2020, and you will see that there is sometimes a very long delay between the first and the last imaging. It was in Pitié-Salpêtrière. So the first and the last CMR were compared, and we performed multivariable analysis to search for independent predictors of cardiac involvement resolution. The variables was included in the model if their p-value was below 0.1 thresholds on univariable analysis. So 46 patients, the median age was classical for ECD, 63 years old. The median delay between the first and the last imaging was rather long. You can see it went up to 7 years, and almost all patients were BRAF mutated in this series. The patients received between 1 and 3 treatments, and of course, all patients included in this study had a cardiac involvement at baseline. So this is a flow chart. 99 patients and 46 had multiple imaging during follow-up. And you can see that more than the 2/3 of the patients, 6 and 26 for the partial resolution, had an improvement of their images, and there was only 2 patients in the series that worsened. So if you look at the this figure showing the various sites of involvement of the disease, the right atrioventricular sulcus, the right atrial wall, etc., you can see that on the left part of the figure, there is either a partial regression or a complete regression. And when you get on the right, that is on the pericardium, it's usually stable. You usually have more than half the patients who have stabilized disease, and there was usually only stabilized when we could analyze the aortic involvement. If we compare the regression that is partial or complete, or no regression, there is no difference. If you look at the age and the imaging delays, you can see that it's statistically not significant. And then we perform an univariable analysis. The patients with regression of their infiltration had a lower rate of death, a higher rate of atrial infiltration, late gadolinium enhancements, which I will show you some example, a higher rate of hydronephrosis, and a lower rate of prescription of interferon. There was no difference, again, on univariable analysis between the patients who were on VEM and not on VEM. On multivariable analysis, the only criteria that only thing that changed was the death, which remained significantly associated with the following imaging status with an odds ratio of 0.1, and the other feature like atrial infiltration, late gadolinium enhancement, and all the other were no longer significantly associated with the imaging status. If we perform a survival analysis, you can see that the patients that had a regression here had a longer survival probability than the patients who did not, among which we didn't see a regression of their infiltration. Here are 3 examples, and you can see again that the images between the first image at baseline here in June 2015 and more than 5 years after can show you that over time under vemurafenib you can have a large regression and almost normalization of disappearance of the right atrial infiltration. This is again another example over 7 years, this time 6 or 7 years, with again a regression of the pseudo atrial infiltration over time. And here under MEK inhibitor cobimetinib, you have here a baseline in July 2017 with the pseudoatrial tumor, and down you can see the late gadolinium enhancements, which is a very important marker to follow and which disappear over time. This is over a 5 years period. So the conclusion of that work is that a partial or complete resolution of cardiac involvement was observed in more than 2/3 of the patients with ECD and was significantly associated with a lower rate of death, again with a multivariable analysis. And I think this is an important message to try to modify not the treatment, but to modify how, because this was some kind of retrospective, and to prospectively analyze we know that now that MRI of the heart is some kind of a gold standard for looking for this kind of involvement, but also to try to look with electrophysiologic analysis of the His, and to try to be sure there is no conduction involvement among this patient, and for the rhythm also. And it is something that we do not do at baseline, even in PT-Salpêtrière. And I think we should definitely try to analyze all these data along with the clinical events and the MRI finding. And with that, I want to thank many people from PT-Salpêtrière, especially Marine Bravetti and Philippe Clouzel, who are the radiologists who performed and analyzed all the patients, and of course, to analyze all the MRI, and all the patients and the ECD Global Alliance. Thank you very much.
Thank you. That was great work. The late GAD enhancement is, I think, represents fibrosis. Do you think this is reversible with treatment?
I think with certain, I think mostly with targeted therapies, you can have some kind of improvement of this aspect. I think I don't have recollection of patients with interferon alpha or other biologic drugs with regression. I think it's rather long. I mean, you have a long delay to get improvement of these aspects. And again, it's only with a couple of, 46 patients. I don't remember exactly the number of patients where we saw the improvements, particularly of the LGE.
Julian, in terms of the treatments,
yeah,
did you just look at VEM, no VEM? What were the comparators? Because I would think that patients on targeted therapy improved, and maybe those who didn't.
I wouldn't like to tell you wrong things, but I think that on univariate analysis, there was no difference between VEM and no VEM. But I would have to look into details if we compared VEM and interferon. I don't know if we had enough patients under high dose of interferon in this particular study. But I agree with you. Yeah.
Besides this study, do you see an excess of coronary artery disease in these patients? I mean, is it your feeling that they?
Yes.
Significant increase?
This was in the European Heart Journal. Yep, the big study published 6 months ago. Yeah, we have more than 20% of the patients who have either coronary heart disease or myocardial infarction. The only problem is that it's a retrospective study, sometimes with cases in 2003. And so at that time, although most of the patients had MRI, sometimes cardiologists said to well see the coronary, it's better to have heart CT scan with gating, to the so it's often lacking in the older cases where sometimes the patients have myocardial infarction or coronary heart disease, and you don't know if you do not have like an imaging at baseline or before having some kind of treatments. In particular, in the older cases, patients had the steroids, or sometimes they come to you the first time with steroids. I don't know if I answered.
But the 20% is the
overall
clinical and subclinical.
Yes.
Okay. Because anyway, it's a huge percentage
as
compared to the general population of 48, 20, 50 years. It's
Mm.
it's a great increase.
So this advocates, I think, for really at baseline, try to have as complete as possible, France we say coroscan, I don't know how it's in English,
Yeah,
but to have a
CT
CT scan of
angio
the
CT.
coronaries and
of the coron-
coronary and try to see exactly what's having the status at the beginning of the treatment.
Hi, Dr. Alsh. Thank you very much for the presentation. With regards to the patients that had improvement through MRI over follow-up, did all of those patients had continued TKI therapy throughout all of that follow-up, or did you have patients that had held the TKI in the setting of maybe intolerance?
No, I think most of the patients were under treatment. Sometimes it was tapered and were under like one VEM or one COBE every day, but I think we didn't stop. Again, I would have to check again, but most of the patients were not under vacation or under just surveillance.
Thank you.